I'm the Clinical Services and Education Manager at the Learning Corp, and I'm also a speech-language pathologist at Spalding Rehab Hospital. I work with individuals who had a traumatic brain injury, a stroke, aneurysm. The types of disorders that I work with are communication, cognition, of people with aphasia, people with dysarthria and apraxia. I learned about speech therapy from a young age because of my grandfather. He had a stroke in his 40s. My dad remembers being in the hospital and my grandfather picked up the paper and started to read it, but it was upside down. But he was a fighter, and 6 months after the stroke, he went back to work. But the communication piece was really difficult for him, so he would practice speaking on a tape recorder and he'd practice writing for hours. That really opened the door for me into the rehab world, and I really wanted to work with people who also had aphasia like him. My hope is that with these types of programs like Constant Therapy, people are able to access therapy and they're able to access ways to continue to improve their skills so that they can reach their goals and get back to what they were doing before the injury. Technology is absolutely a really valuable tool for people who are recovering from an injury. There's so many ways that they can use it, and it really allows people to practice those skills more frequently and more intensively. Patients and families are really wanting to know what resources are available to them. That's part of our duty, is to be sharing this types of information and educating the patient and family on what's available. I always think about, if it was my father or my mother or my grandfather who's in therapy, I want to know every resource that's available to them. I really wish that when he was alive, there would be programs like Constant Therapy out there, because he would have definitely been on it every day.